Welcome to the Black Health Perspective, where we'll talk about our health from our perspective. We're back. We're back. And our dog is determined to be in the scene, but that's fine.
She's fine. She's family at this point.
We are excited because we have finally gotten to the point where we are back on target to have guests in our home, in our studio, and we are excited about talking about health literacy, and we have our friends with us, and we are so excited.
Welcome.
Thank you, thank you, thank you, thank you. So today, February is Cancer Awareness Month, but also so that we can also tie in other health literacy related topics. We also want to begin to talk on just some of the beginning things because we want to make this like a two-part series. So first, I'm gonna start with introductions. I am honored today to have Kimberly and Moses Roberts. Right? Look, I cannot.
I don't have a badge to read. So
You do know your name, though.
So I want to go over just a little history. First, I want to say me and Kim have been high school class friends since high school. She will tell you she has ankle issues because I ran over her ankle.
But she's still my friend. You're still my friend.
So let me do an introduction. Kim and Moses have been married for 22, going on 23 years this April. I got to stay towards the mic. I'm sorry. They have 4 beautiful children. Kim is a stay-at-home mom.
Still a lot of work, though.
I know it. Listen, I honor you. And Moses has been employed with Gulfstream Aerospace for 32 years. Correct? That's
yeah,
correct.
30 full time.
30,
but
30.
I co-op there, so it's been a long time.
Okay.
'Cause I interned in co-op.
Okay. But some other things about us that leads us into health literacy is Kim and Moses also has a child with special needs.
Yes.
And Moses is a 2-year thyroid cancer survivor.
That's awesome.
Listen.
That's pretty awesome.
It is.
Especially
It
to
is.
have survivor behind
To
it.
have
That is
survived.
yeah.
Listen, yes.
That's a big deal.
Yeah.
That is.
Yeah.
So let's get into it. And we want us to just be as comfortable as possible. I want to start off because I want to really focus more on health literacy, and then we'll lead up to diagnosis and things that you faced on that front. But let's start from the beginning. Can we get you all to do a little introduction on things that I may have not said that you may want to put out there?
As far as the cancer portion or because it's a lot, like the special need, you got a special need, and then you're dealing with an illness that you didn't expect at 48.
Okay, so let's start from the beginning. When you all were dating, prior to you all dating, or prior to you all meeting, we had this question beforehand. Were you all individually leading healthy lifestyles?
I was.
I ain't gonna tell y'all no story. When you young and dumb, man, you was just living.
Okay.
And I did whatever I wanted to when I wanted to.
I think that's probably the farthest thing at least for most men.
For most men, yeah.
Farthest thing from your mind is,
Yeah.
That something can happen to you, or, that anything, I guess, can happen to you. You just kind of live your life, and if you're not sick, you don't feel bad, or you're not injured, what do you need to go to a doctor for? I mean, that's how I was thinking. I never really gave it much thought about seeing a doctor on a regular basis,
You got some money in your pocket and somewhere to go, you just go do. You don't worry about no health. You just keep going.
I know, but did you have a family history that you knew of?
I mean,
prior, even though you were being, like, for me, I knew at an early age that we had diabetes in my family. I didn't know about hypertension, but I knew that diabetes was very prevalent in my family because a lot of my family members had already experienced an amputation. So like my grandmother, a great aunt. So I guess it was right in my face. I knew that diabetes was a part of my family history. Now, it doesn't mean that I had incorporated a lifestyle
Or understood.
or understood. And plus, I used to have to give my grandmother her
Oh,
insulin
okay.
shots. So I knew that diabetes um, was a part of my family history.
But as far as like what's the scope of diabetes, like I just
I
know,
didn't-
yeah,
yeah,
you
I
didn't
just
know,
knew.
You just
I
knew.
just knew.
Know it's diabetes and you need
know.
insulin and
Right.
Yeah.
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 For me, it was different. I mean, I knew my grandmother had diabetes, and I knew that she was on dialysis. She was on peritoneal dialysis, and my grandfather took care of her. But as far as the explanation of the who, what, where, when, and why, I was a young preteen, teenager, and I didn't understand and didn't know. Nobody explained it to me. It just was what it was. All I knew was my grandfather took care of my grandmother. She had diabetes. I didn't know, or nobody told me that it was, you could inherit it.
Exactly.
I
That
just
was
didn't
never
know.
the conversation.
I didn't
It
know
was
a
just
lot of. I didn't. I mean, I'm a kid,
Yeah.
and I didn't know what I know until I got into the medical field.
I knew all about it. I saw it, but that was them. It was not me.
Yeah, that was-
I
yeah.
really didn't care.
So you didn't
I
relate
cared
it.
about the people with it. My mom, on both sides of my family, they had it.
But you didn't
Grandparents,
understand.
both sides. But when you young and dumb and you just living, you just go do.
But
It didn't happen to me, so I wouldn't worry about it. You go help people. I cared about it. Man, my mom was shooting needle for her diabetes for most of my life.
Okay.
But you didn't understand that you needed to care at that age because you were young. That because this may be me,
Yeah.
which I will say it took Moses longer to experience those health issues than your other family members, than some of your family members.
And I don't mind telling people, it was one day we had went to a party, and I looked at a picture from the party, and I told my cousins and Kim off, like, well, you ain't tell me I hadn't gained so much weight. And then I was like, I got to do something about it.
So do you feel like, Kim enhanced or encouraged or made you think more into your health? Like once you all got married, did you all explore your medical history together, or did it take an event for you all to realize that your health was just as important as your financial stability for your family?
I think for you, it was an experience that you had to start being more focused.
Yeah, we always knew about health and taking care of the kids and taking care of the family. And, by nature, just the way I grew up, my folks from a small country town. I'm from Savannah, but they moved down here. My main focus was as long as I could provide and I wasn't feeling bad or nothing like that, that's just okay. But it looks a little bit different, though, when you hit a roadblock or something, you get sick. And you realize you're not invincible, and then things change a little bit.
Experiences change.
Change.
It make
Yeah,
it-
and I
make
think
look-
it was the first experience you had with health. With,
absolutely.
Yeah, where he really started focusing on, let me go to the doctor annually versus when I'm sick.
right.
Because
So-
that's what most men, they just go
Yeah.
when I'm
Yes.
sick.
Something
Yes.
happens.
And in our experience, we go annually.
Yeah, because
Yeah.
Well, my wife and I were talking about that the other day. Women, they have things going on in their biology that necessitates them going annually.
Yeah.
Mammograms and that type of thing, and where we just don't have that.
Yeah.
So it's
So it's second nature
it's-
for you to
we
go annually.
we go
yeah.
reactively as opposed to going proactively.
and I do agree with my husband on that, but I also think that, and maybe I'm diving too deep. I think as women, we do, because we prioritize the nurturing spirit and taking care of family in that aspect, that I think for me, I think mentally it is also a thought that I have to stay healthy to take care of my family. I mean, do you feel
For
like
some,
that?
for some, well, I always, well, for me, I learned a little early about nutrition, health, because of a life experience at 17. So therefore, I was a little bit more serious than what my peers were. So for me, that experience made me stay more current on like going to the doctor. Like you have to do this, and if you want to. And then I started seeing stuff differently, like certain things that, and it wasn't because it was a choice. It was something that I had to
To
do.
do.
Yeah. So
Correct.
I learned differently, and then going to the doctor. Like I like to go to the doctor. They tell me what's wrong.
Yeah. I mean,
Give me. I mean, we're probably gonna edit and pause at this point because I'm gonna have to hurt Coco. I'm gonna have to. But you think we need to pause and put her in? Okay, let me close.
I don't
So
think Coco doing as bad as what y'all think it is. That
really,
is
can you
real.
hear her? You can hear her bad.
hear her.
Yeah.
But if you put her up, where's she gonna bark? Yeah.
Yeah, but Coco part of the health story. Y'all know dogs are good for your health.
Okay,
Yeah, 'cause
so
they
we could.
A
they'll
dog could
sense
take away
out-
anything.
Look, and not
Okay.
only that, they sense diseases
So how y'all gonna
nowadays.
take? So how y'all gonna take the dog out of it? Everybody
Okay.
should get a dog if they know what I know.
Okay,
well, she
it's
got
okay.
reprieve
Please,
then, I
yes.
guess.
Okay.
So thank you, Mr. Moses.
I know, right? Look at her. She like, I'm just protecting y'all anyway.
Sit down. Sit.
Well,
sit
I'm gonna
sit,
tell y'all
sit,
though
yeah,
about health, and I'm not speaking for a lot of my homeboys. Until you hit a roadblock, your health really ain't at the top of your list,
You
and it
know,
wasn't at the top of my list. Yep.
so I'm happy you said that because with me becoming a provider as a nurse practitioner, a lot of the male participations that I had, it was because they were experiencing this roadblock, as you call it. And I don't even know if they really only wanted to take care of the roadblock at that moment.
Ain't nothing
Like,
else.
yes, like let's get the roadblock taken care of so I can get back to work. I can get back to doing what I need to do to provide. You know, so I wanna let's I wanna talk about, if you would mind, can we talk about the first roadblock that you experienced that made you take a deeper look into I need to focus on my health.
Yeah,
And
I don't mind. I think it was late 2007. Had a good career, hanging out, doing things guys do. I ain't gonna lie, we drunk a lot. We hung out. We did all the things that we did. We real young and stuff. And then my granddad got sick. One day I lifted him up, and then I got sick, and I thought I had like a hemorrhoid because I don't know if anybody ever caught somebody that's just dead weight. It's a lot heavier than what you think.
oh yeah, we know.
I know, right?
So-
Y'all
Definitely know what
they in the
that
medical
feels like.
field.
So it made me sick, and then I got down, and then I got something called, I think it's cellulitis. It's like a blood cellulitis, and it's something that jump on black men a lot, and you just don't know why you get it. Some people say it's stress, but it can be anything that jump on you. But it got so bad in me. Next thing you know, I was in the hospital for a week, got an ass at hospital in a week, and I'm in 6 months of work. And I tell anybody, it'll change your life when you go through something like that. Because, men, we have that list. Hey, I could take care of the family. I got money. Everything taken over. I can go have fun anytime I want to. We could do anything you want. But I tell anybody, you get sick and you laid up in the bed where you can't do for yourself, then it change your whole perspective and your way you look forward because you can't do those things, and then you realize it just realign your life to a point of that you really can't control much. You floating on a boat that you never want to go back down because tell you something. You want to be able to take care of yourself because nobody can take care of you better than you can for yourself. And it's a vulnerability and it's a mental thing when you get to that point because, man, we want to take care of people. You want to take care of your lady. You want to take care of your kids and all. When they taking care of you, it's a guilt come over you that you don't want to do so. Once you go through those things, you try to tell yourself is, oh, I don't want to be in that position no more.
Mm.
It don't feel right. And then you got your friends and all, they calling you. They calling me talking about, I like cars and talking about cars and doing stuff. And I'm just laying up there. I'm comforting them. And in the back of my mind, I'm like, none of that stuff don't really mean nothing to me because I'm sick at the
You got a
moment.
different
But
perspective
you're
on
Yeah,
things.
different, yes.
and I'm not gonna say it mess you up, cause it don't mess you up. Cause when you come out the other side of it, it make you stronger. But then you start taking more into account. Your wife be telling you the whole time, you know what? Don't make moves like this. Do moves like that. But I hate to say it, I'm one of them hard head ones. I gotta hit that road. I'm that kid. Don't touch the hot stove. I gotta go touch
But
the
the hot
stove.
stove. Yeah.
And then when you learn from it, then you move on from it. But you live and learn. But I just don't know. I don't know what to say it is. It's just you feel like Superman will tell you hit that block when you find out, oh no, you not Superman.
It's real after
Correct.
No, it get real,
It get
real
real.
after that.
It gets. Um, I think we had a similar experience when Brian had an episode of atrial fib. Like we, I think as wives, we, I stay on my kids, I stay on my husband. Like you need to go to the doctor. I go to the doctor. Um, we go through our yo-yo of trying to eat right and
Maintaining weight,
maintaining weight and cooking right. And then you still have those um but then when that life changing event occurs, like you say, as far as me as a wife, um I was out of town. I was at camp.
It was just an ordinary night. I've been feeling fine. Um, in the evening time, I'd come from downstairs, was going upstairs, getting to bed. Laid in the bed, and I could feel my heart racing. I'm like, well, maybe it's just because I'm out of shape when I was walking up the steps. And I'm laying in the bed now. It's been 15, 20 minutes, and my heart's still racing. Still going. I'm not having any pain, so to speak, but something's not right. I'm checking my pulse. It's not regular by any means, which is abnormal. And thinking to myself, this just doesn't feel right. So foolishly, I told my son, hey, I'm going to the hospital. I didn't ask him to take me. Not very smart because, things can happen. Long story short, I made it to the hospital. They put me on the machines and everything, and my heart rate was 160s, but it was irregular, atrial fib. And fortunately, I wasn't having any kind of really symptomatic kind of issues. But they got me in there. They started me on medications, admitted me to the hospital, and let my wife know she was, you know, in a state. She was wanting to come back. And I'm grateful for that because, you know, she could have just easily said you'll be okay and kept it moving. But her being in the medical field, knowing that this could easily be a different kind of arrhythmia, and it could have been something more significant than just atrial fib. It just happens just like that to people every day. So they treated me. They gave me the medications. I did all the routine tests. They couldn't tell me why it happened. It just was one of those things, and it resolved less than 24 hours later. And then they sent me home. But then I'm laying there. And this is how your perspective changes. I never in a million years thought that I would have had something like this happen to me, because I was not living in a terribly unhealthy lifestyle, but it wasn't the best. I was exercising, but not regularly.
Not constant.
And it's just one of those things, and I'm like thinking to myself, I'm fortunate that I was able to recognize this irregularity. Number one, number two, that I was not one of these ones who just said it'll be okay and left it alone, because it probably would have gotten worse. And number three, thinking the biggest thing is that it could have been any other rhythm that wouldn't have allowed me to even wake up from. And think about that from time to time. And you nothing's promised. Tomorrow's not promised. You try to live your life today the best way you can. Mimi looks out for all of us in terms of how we eat, what we eat. Not to be in excess of the things we do, drinking, and fortunately none of us smoke. So those risk factors are minimal. But at the same time, you think about things a different way. And it could just as easily went left as opposed to going right. So fortunately for me, when we got together, I'm like Moses. I didn't give a second thought about going to see a doctor.
Just
What
live.
for?
Shit, what for? I ain't sick.
And he works in the medical field.
That's good that you do because you was able to like this not right
Yeah.
when you were laying there too.
You know,
so, like,
and since we've been together, you know, shortly after we got together, committed long term, started going to see a doctor every year, at least once a year. You know, and you find out about get your labs done and high cholesterol and blood pressure and all this kind of business. And you know, we're getting older, so she pushed me to be more cognizant of my health and well being because I sure wasn't doing it.
Yeah, same for me, my wife. 'Cause y'all know me, I could say something done. Something happened to me, y'all'll be financially taken care of, and she don't want to hear that.
Yeah.
I tell them in a
More
heartbeat,
to
man.
it, just
Yeah,
that.
I
it's
just-
more to it.
man,
Yeah.
I'm quick to the point. Oh, you'll be straight.
yeah.
And
But
they'll be
you-
like,
but
I don't want to
They
hear
don't
that.
want that. They, you
yeah.
know,
Not only that, you didn't have kids to make sure something happened to you. You're supposed to help your mate be the best that they're gonna
Right.
be. So whatever that is, like not something happened to you and I'm okay because the check gonna be good.
So after that event, were you more open to listen to Kim's suggestions, or what type of lifestyle changes did you all
It was a gradual.
implement?
It wasn't. It was still a little slower listening.
Yeah, it was gradual, but anybody that know me, I got a real strong willpower. So for years, they called me Martin
Yeah.
because I got to switch. If I make my mind determined about something, I could do just about anything because I get anal about it. Shout out to my boy Anthony Bryant. I used to work out with one of my homeboys from the neighborhood. Got a personal trainer, and you know, then I started getting real serious about it because I took my weight and I kept my weight off since '08, and I did it by, you know what, trying to learn how the body function because most people don't know how the body function.
that's true.
You think dieting work, but all that do is make you replace glucose in your blood and store fat. Your body got to think food plentiful. You lose more weight if your body think you can eat anytime you want to. So I put those things in. Then I started watching what my wife eat and start eating different. Cause y'all know, man, we in the South. It ain't a
Yes.
meal unless I got me some ribs chicken, macaroni, cheese,
rice,
some
kind of
potato
sauce.
salad,
potato salad.
Yeah.
I'm like,
Well,
it's
just
not
be well.
Thanksgiving. It's not Thanksgiving.
Man.
Not every day.
It's not every day.
We in the
It's for
South.
Thanksgiving.
Yes.
Back
Like,
then, we young, we probably cooked out like that. You probably had 15 cookouts a year you went to like that.
yeah.
I think also too for me, as I look back at it, you know, not just being a healthcare provider, because you know I worked in the emergency department for so many years, and from time it saddened me to see so many individuals younger than me, my age, individuals that I knew, individuals that I knew by association to someone else, and to see them so deteriorated or so unhealthy. And it's like I only had a few, and I do think it gave me anxiety, you know, because it saddened me, and I had this anxiety like I don't want to be like this at home. I don't want to be like this at home, and I probably do cause my kids and my husband more anxiety because it's like if I'm not up on, and like yes, we need, our BMI is elevated, we need to lose more weight, and it causes me to be like, we need to do this, we need to do that. And then I start incorporating what I remember about my grandmother, and you know, then my mom, she has diabetes, and I'm looking at what she eats, and it compounds on me. Does that make sense?
Because you're worrying about everybody.
Yes. I'm not
Yeah.
asking for, I know we all have to leave here.
Yeah.
I don't want to leave here being a burden on my family. I want to enjoy, I want to enjoy those years with my family. I want to know that I haven't left a financial burden from them having, because a lot of people think like Moses, you said, if I leave here, you all are taken care of financially. And so I ask the question sometimes, but what if you didn't die? What if you've had a major stroke and then you were required to have a health care or someone to take care of you um, every day? That is a financial burden that I don't think many of us realize occur on a day to day
A lot.
basis.
Yeah, that's a big deal. You know, one thing I give it to Kim. Once we had the kids, she was like, "Yeah, you got work insurance. We need insurance outside of there." And I'm never gonna forget it. I'm in there. Oh gosh, what is maybe '03, '04? We just had been married a couple of years.
Oh yeah, that's
Uh,
when we first got married. So when we first got
yeah.
married, you know, in my family, that is a big thing with insurance. So we got married. I was like, oh, I got to get a policy. He's like, what? Oh no, you need an insurance policy. So the policy, he had to get all this testing. He's like, what is this?
So
What
so what you want to do? You want to get it as young as you can.
Yes.
Yeah.
If you can get 1 million, you go get the million then because it's gonna be real cheap.
Cheap.
Mm-hmm.
They're
Yes.
gonna make. I'm like, why I gotta run on the treadmill for you to give me the insurance? Why I gotta take hair off my head?
Why
Why,
they
you
gotta get
pulling
blood?
hairs out my nose and out
why
my
you getting
ears?
blood? I was
And why
like,
you taking blood? But it's probably the best thing I ever did because you go back '03, '04. Yeah, they've been taking $70 a month for a long time, but you can't get that now for less than 400 a month, or
Absolutely.
500 a month.
Yeah,
Absolutely.
a lot of people don't know that.
Yeah, they don't
you
know
know.
that.
They don't think
They
about
don't know
that.
Yes.
But
and even for your kids as well, like policies for them that builds cash value. Look, that's another topic.
That's another listen. That's why I said
It's-
even
yeah,
from your
financial literacy
yes,
is part of it too.
Yeah.
even
that's
from the introduction, I was telling Brian, even from the introduction alone, when I introduced you all, there are so many segues we can go off. We can talk about cancer.
Yeah.
We could talk about financial literacy to prepare, how it links with health
Yeah.
literacy. I think what I really wanted to focus on was the beginning. At what point you all began to realize that our health is just as
Just
important, and also tied into let's talking about your cancer and talking about some statistics that go along with that. Because we'll definitely be having you all back on if you don't mind. Um, because my goal is to get out to the community that talking to your partner about family history, um, incorporating the importance of yearly um, screening and health visits from your provider. I do understand that some individuals, Warren, I do understand that some individuals um, don't have insurance because, based on the 2022 statistics from the CDC, only 10% of African Americans of blacks had health insurance. Um, but there are other resources. There are other income-based primary care clinics. There is a big push for direct primary care where individuals can pay a subscription. Um, I'm gonna shout out to Dr. Lawrence because we've had him on before. From Harvest Medical, who like individuals can have those yearly labs and understanding what those labs mean, um, preventative measures that you need to take to improve those labs. I just think that, especially us being here in the Savannah area, as we are getting older, we are seeing a lot of friends leave here
way prematurely.
way
too early.
prematurely.
Maybe too young.
Yes.
Yeah, I know.
And not even friends, just people.
People, yes.
In
general.
general, like 50 is the age where you should be more concerned or versed on what's going on with you health wise, because that is the age where you see people don't make it past.
I think 50 you need to be I
Yeah.
would like it that 50 you are an expert at what's going on
Exactly.
with you health wise.
Yeah.
And I just think, especially in the climate that we are currently in, I don't know what else to do but to offer information, preventative information, like women knowing to begin their breast mammograms at 40, begin having yearly or every 3 years for Pap smears, but men and women colorectal cancer screening at beginning at 45, and we were even looking up.
It's 40 now.
Well, it depends on your history too.
Yes,
Yeah,
it depends on your history,
your
It
family
depends on
history.
your
Yeah.
And then also there are other options than going to the gastroenterologist,
Yeah.
even though that is a great option. But
'Cause
if you have limited income,
They have
eh,
that little test that you do.
we can start off with just basically you can start off with a test that they mail to you at home.
At home.
And in the privacy of your home, going to have sampling, send that sampling off to at least see if there's any DNA abnormality. And individuals think that costs a lot, but you can actually call the company and pay for it over time, and they still ship it to you.
So I'm gonna bring up something and nobody gonna believe me when I say it. Y'all know people with insurance don't go to the
They
Oh.
don't go to the doctor.
That's even worse. I'm just
Yeah.
telling you.
Yes.
Even
We know
worse.
some people like
Yes,
that.
we had
Yeah,
a few.
yeah,
We
yeah.
had a
Yes.
few family
What are you
members.
paying this
Like
money
you,
for?
you,
It's
you
just
don't
that.
even realize how much at your fingertips you are wasting.
Yeah.
Like you're not even going just for an annual.
Yeah.
So
Yes.
that was me. I'm gonna be honest.
Yeah.
I had insurance the whole time.
Yeah, he didn't.
Only reason I went and did blood work once a year to get the
The
deductible.
deductible.
They
And
give
the
you the
decrease.
deductible thing decreased on your policy. But
Come
what
on,
helped me
please
with
go
my
out there.
cancer? Because you said you want to say what
Please
with
go
the
out
cancer.
there.
After I had that episode, I got sick, so I just started going to the doctor. So let me just get that out there now. I still don't like going to the doctor. I hate it, and I go to the doctor at least 4 times a year now.
But it's a
You
realization you come to
know
that's something you
he's
need
forced
to do.
now, and they get on the phone
And they'll call her.
They like Miss
I
Roberts.
hate it. I'm just being honest. I
Why
hate
y'all
it.
calling me? She's like, it's not for you, it's for your honey. I was like, oh, okay, well, let's call him. Make
Okay.
an appointment.
Okay.
But on my annual 2 years ago, I guess that was the end of 22, 23.
Close her. Yeah.
Just part of it. My doctor, and I call her name out, greatest doctor, Dr. Kasuma. She felt my neck. She was like, you ever had thyroid problems? You having problems swallowing or nothing? I'm like, nah, I'm eating good. She was like, we just send you over there. You get a little sonogram on there. They came back. They say, well, it looks suspicious. You sure you never had any thyroid issues? I said, no. But then she went back to family history.
His mom.
And my mom had thyroid issues. She had a thyroid taken out when I was born. And she was real sick with that. So that made a dick from the history. So then she say, I'm seeing you for a biopsy. So I'm like, I already hate going to the doctor. Now y'all gonna send me over there? That biopsy, I don't wish that on my worst enemy. But they did the biopsy. So the doctor was like, man, it looks suspicious. But he's like, it looks suspicious. Probably nothing. So you can live without your thyroid. I'm gonna take him out. So this is in a 3-week period. This whole thing
Really?
happened in a 3-week period. So the doctor, biopsy, sonogram, all in 3-week period, and we in the month of December. So it was like
he
you
wanted to
take it out.
wait
I was like, well, I'll wait.
because I go on vacation. I'm like, no, let's get it done before you go back to work because you're already on vacation for 2 weeks. So he's like, well, he called and they said, well, we'll work you in. Luckily, they worked him in. They worked him in on December the 18th. You went to 17th.
The 17th.
17th
So
of
they called
December.
me at work, say we can work you in. You'll be in the hospital maybe 3 days or so. And I went in. They did the surgery. It went good. And they said, we'll do a full biopsy and it won't be no things or what else. So they took my thyroid out.
And then you only had to stay in one day.
Man, I went home.
He went home that
My
same
numbers
day.
was looking so good and all because I had started watching out for my health
Right.
and doing things. They actually let me go home the same
that
day.
same
That
day.
is not a day surgery. And they let me go home the same day. I was doing good. And then when I went in for the checkup from the doctor, I'm sitting in there, Kim, you was in there with me. And the doctor came in and sat down and said, you had cancer. So I was like,
He said, you had thyroid cancer.
yeah. And I said, come on, back up
Right.
and let me know. And let's
He
just talk
said-
about
He
it.
said it was encapsulated. And I'm just looking like, okay. He said, but it didn't go outside. So they wanted to do around irradiation, but
They said we'll do one
but
round.
they didn't because by the time he went back and he started going to the endocrinologist, everything looked fine. So she watched him for a while.
They kept watching. They said don't.
Then she said, "Don't worry
You
about
don't have to do it
at
because
this
they just
point."
give you one just to make sure it don't come back.
Yeah.
But it came from preventive is the reason why I bring the story up.
Yeah.
There you go.
And it was me doing what I don't want to do.
Yeah, that's the
I say
whole-
that to everybody that listen to this podcast. I share with all my friends. Nobody want. I'm speaking for guys. None of us want to go to the doctor. At least not me.
I think the
Hey,
whole
man,
point is to get that information out.
Get
That
it out.
preventative maintenance, preventative medicine is a huge component to not be in a position where you have
can't
to be
control it.
reactive.
Yeah.
Exactly. You don't want to get to where it's too late. You know,
Yeah.
and you know, to get a report that says you had
You
cancer
had cancer.
is a whole lot
Like
better than
that
this
just
doctor
says
saying you
you
have
You
cancer.
have cancer, and
Yeah.
it spread it to
Exactly.
X, Y, and Z.
Exactly. all
And then
because
we
of-
don't know. You only got 6 months.
Oh,
Or-
yeah.
Oh, I don't want y'all to think different now. When they said it's suspicious that you could have cancer, oh, it was suffrage. And I know I got a twisted mind. I'm like, well, I didn't know when I was gonna die last week, so what difference is it? But that's just my mind how it is.
Do
so
you feel like that was a protective mechanism? Because I'm sure, like you said, that provider in you began to say, I have 4 kids. I have a wife. I understand the money that you said you had set aside. You have set aside or have planned out that your family may be will be financially taken care of, but still to say there may be weddings,
Yep.
there's graduations that I'm missing.
see that came on later, and I'll tell this to any guy. At some point, for the real health, you got to be able to say, "Am I living for myself? I'm living for somebody else," and what the big picture look like. And then once you start saying you living for more than just yourself, then it make you move a little bit different.
Yes.
Because you move funny when, I mean, it's probably cocky to say, you know what, they'll be all right. She used to look at me crazy when I said, hey, just keep them out of this and this right here. When you move on, when I'm gone, she's like, why would you say that? But it is a mechanism.
It is
You just
a-
don't want nobody. Because I still can't get out of my mind when I got sick the first time. I don't want her or none of my kids to ever have to take care of me. That dreads me.
well, you know,
It
like-
don't feel right.
But
Like
that
you
is why
said,
you have
that
to
was
take
one
care
of
of
the questions.
yourself
Yeah,
and make
yes.
sure you're doing the right
because
thing.
it's not an issue comes up. It's not always a finality to it, like Mimi said. It could. What if it just?
But if you don't
What
die,
if you don't
Yeah,
die?
that's
And
right.
then there's all that goes along with it, and it's you know, now your spouse is a caregiver
Yeah.
to an adult person. There's financial repercussions because of that. There's psychological repercussions because of that. There's all kind of different
It's a lot of
pressures.
different things.
I'm sick I'm a butthole sick. I don't want them to see me. I didn't want them to come visit me at the hospital. Am I linking? I kicking out people. They trying to come visit me. I probably sign myself in somewhere else and say I don't want them to come see me like that. That's just my mental issue. But hey,
and Kim gonna cuss you out
Yes,
and
like,
kick
look,
right on in
And
there.
then tell him what he not doing. Now you came here to get well. Leave these people and let these people do their job.
but you know everybody's different. But
Yes.
man, but
Everybody's
I
different.
just I
Yeah.
feel like I'm weak if
But-
they see me sick. I don't want
But
them
then
to see
too,
me
a
sick.
lot of people they don't. It's the whole aspect of dealing with the medical field, the medical issues. Some people are squeamish, like certain things. Like I'm squeamish of certain things, but I know the things that I need to do to make sure what's being taken care of. Like I'm not the best nurse when it comes to certain things, but if either one of them in the hospital, I'm going to be their best advocate. Now, I'm not going to
Correct.
watch when stuff going on, but I'm like, no.
You're gonna
did
make
you-
sure it goes
Yes,
on.
like,
yeah.
and it goes on like
Right.
it's supposed to. Like, why you, doctor, why you didn't put your gloves on?
Right.
But
You
see,
know,
all of
there
y'all
are
done worked in
certain
the
things.
medical thing. She done worked in doctors and you and Mimi in the doctor thing.
The
So, you know, I be looking
Yeah.
at y'all when y'all be talking about doctor stuff in the back of my mind. I'm like, man, I'm straight Carver Village. I'm going to try to make sure I don't pass out.
You better shout out.
So,
You better
straight
shout
out
out.
the Carver
I
Village.
know, right?
CVU all over.
But
Curly
it's-
Smith.
But you everybody got to know their role too. Like, what's your role when certain things happen? Like,
You know, but
it's
I think
okay. Yeah.
With the information that we're putting out, you're more prepared for that role if it's in the back of your mind. Some of the
Exactly.
consequences that may come up, and I think that's why it's so important for us to be having these discussions. because you don't want to be reactive.
Exactly.
Yeah,
be
you want to be.
proactive.
We want to be
Proactive.
proactive.
Yeah.
You want to get ahead of
Yeah.
it, stay
Yeah.
ahead of it as much as you can. Anyway,
As much as you can, because
you know.
as much as
you
you
just
can.
don't know anything.
You
can
don't.
happen
Right.
on any
You don't
given
know.
day at any given time.
But if you're doing the best you can,
Yeah.
it's more likely.
Right.
You won't have to deal with. Yeah.
So, you mentioned life insurance, which is great because a lot of individuals, and I think at a later date, we will begin, if you don't mind, we will talk about um, financial literacy to go along with health literacy. But like I said, I want to kind of redirect it and stay focused on cancer because me and Brian pulled up some statistics on cancer that. First of all, let me go over what was it? The survival rate.
Survival rate and death rates.
Yes. So we went to the minority, the Office of Minority Health, and the survival rate, the 5-year survival rate for cancers based on all sites. So it's not one specific cancer, but all sites. For the 5-year survival rate for black men were 66%, whereas the survival rate for non-Hispanic white men were 68%. However, when we talked about women, the 5-year survival rate for cancer for black women were 63%, whereas the survival rate for white women was 71%. And I don't know
What's the variables? Like,
yes, what's causing.
are they going to the doctor more? Are they more? And it could be lifestyle and diet.
Right. It could be lifestyle and diet. It could be if it's a single mom, it could be financial, taking care of the household and putting on the back burner. There could be some healthcare bias.
Yeah.
Like, let's just address the extra. Let's just address the elephant in the room. There could be healthcare bias. So I think what our goal is just to really talk about preventative screening and also lifestyle and diet modification. So if I was to circle back, or if I was to go over everything that we discussed, Moses, you said you experienced a health event that made you take a deeper look and dive into your current health status, which made you change your eating style, eating practices, and engage in exercise diet. Well, engage in diet and exercise, so that you began to be more proactive with going to your primary care doctor.
And I was forced. I'm just being real.
But that may be your outlook on it, but you still were open to it.
Yes.
And
Oh yeah, I'm gonna
it's
go
okay.
there. All joke with me.
It's
They say they
okay.
gonna
You're supposed to be
time me
forced
out.
by your spouse sometimes. They're
Thank
supposed
you.
to force you to do
Sure.
some things
Thank
that
you.
may be uncomfortable.
Because look, when Brian, what was that you had? Your carotid ultrasound,
Yes.
and I said, send that to your doctor. Let's go ahead and what did you have to end up getting? Your CTA? Oh no, yes.
I got a carotid ultrasound, which turned out to be okay. But the point is, there was some abnormality
There's
that
something
another
going on.
provider found, and she said, "Hey,
That
you
you
need to
didn't
go
like.
follow up.
You didn't like
I
it.
saw the results and I
You need
said,
to go follow up."
go follow up.
And that's the whole thing.
Yeah,
Something
that's
like
right.
that,
Right.
that could
That's
lead to
right.
stroke.
Correct.
If it's not corrected.
Exactly.
And then suppose I survived the stroke. And then
And
we're
now
right
you're
back
doing, yeah.
talking about this.
Now you got a
financial-
whole lifestyle change because
Exactly.
now we got to figure out how we make you now. Because I'm not gonna say that because that's not gonna happen. But
Right.
you as this patient, how is this gonna work in the family now? It's different.
I know y'all
It's
talking
different.
about that cancer thing, but man, just knowing my friends and all right around here in Savannah and all is that silent killer. What be killing people is that high blood pressure.
Yeah.
So let's
Because you
talk-
can feel good and be
And-
sick.
Well, you think
So-
you feel
You
good.
So
no,
let's
you be feeling all
Good.
right.
Yeah, you.
But they don't be the
boy.
reason it's silent though because they don't realize some of the stuff like when they stomach hurting sometimes they're not realizing that is contributing to something going on.
But some individuals, they're going to work, they're feeling. I mean, just being as an emergency room there and being and recent, now transitioning into being a nurse practitioner, they truly don't
they don't feel
know.
it.
They don't feel it. And when you begin to
That's a bad thing.
take
Yeah.
That's terrible.
yes, I mean, I have high blood pressure.
Mm-hmm.
You can say it's hereditary, um, because there is a genetic component to it. Because we do, I know we're a little fluffy. There are things that we no, I'm fluffy. I mean, I'm fluffy. I listen.
It's a nice looking fluff.
Thank you. But we really do try to take we need to exercise more? Yes. We do need to reduce our BMI, which is our weight, but we bake, we low sodium, with our pasta intake. I even do bonza pasta.
Yeah.
Like we watch our labs. We make sure our hemoglobin A1C we are compliant with our blood pressure medication. And even when my husband had his atrial fib, at that time, I was a nurse and I was in school. And we actually began, discussing, when we began talking about the cardiac issues, and we were discussing sleep apnea. And I was like, and it can contribute to atrial fib. And that is what made me say, hey,
Go get a sleep study.
go get a sleep
Go get
study.
a sleep
And it turns out I have
So you have
sleep
sleep
apnea,
apnea.
Correct.
which contributes to a wide array of other
Oh,
things.
right.
You
Yeah.
get to
So
be Dark Vader at night with all that stuff on?
My mask isn't quite like that.
Yeah.
But
pretty cool, though, for
and
a little
you don't.
kid.
For me, I didn't feel like I needed it because I was sleeping just fine.
Because you felt you were sleeping.
But
fine.
she's obviously next to me. She's like, "No, you stop breathing."
Yeah.
and
which
it
is-
wasn't
Well,
like a
that ain't
snore.
good.
Yeah.
It wasn't a snore.
not
It
what
was
you're thinking.
actually
Yeah.
Like,
stop.
stop,
I'm like,
Yeah.
this don't sound right.
And,
he stopped.
you know,
You went out there with no mirror in front of
No,
you.
I was just like, sometimes I would lay there and I was like, wait a minute, I'm counting. And it wasn't, like I said, it wasn't like it was like,
Yeah.
wait a minute, he's stopping, so.
and I didn't know it. I felt
Yeah.
fine.
Correct.
And again, we found out that atrial fib can be secondary to sleep apnea. It also affects your blood pressure as well. And I felt like I wasn't tired. I wasn't, falling asleep at the traffic light or
Yeah, he
couldn't
wasn't
stay
having
awake.
to,
Well, I
yeah.
was
Oh,
perfectly
okay.
fine during the day.
Goodness.
And we
Come
had,
to find out later on after starting my CPAP machine, I realized that I wasn't sleeping as well as I thought I
That
was.
you thought you
know.
was, yeah.
And this diagnosis, along with other labs and going to see my doctor regularly, found out my pressure was elevated a little bit, my cholesterol was up a little bit, but that's lifestyle stuff too.
Yeah.
But
And to getting
because of
older,
that-
too.
Yeah,
Yes,
yeah,
yes.
absolutely. But because of that, now I'm on medications for those type of things. My blood pressure's under control. My cholesterol is way better than it used to be. And you just
And
make those adjustments.
But see, that is too having a spouse to help
Exactly.
you watch out for
everybody
what
doesn't
you don't
have
realize.
that.
Yeah,
Y'all
because
good.
his-
Y'all close to that medical thing.
yeah,
Somebody
because,
dumb like me.
because
when
his
I used to be rolling
cholesterol
around,
had
I'm
dropped
like,
even
I'm
before
good.
the doctor put him on cholesterol medication. Like we were
watching,
actively
yeah,
making,
watching.
actively
moves
making,
to,
yes,
to be in a better space.
right.
And that's hard too, because it's like what I eat is difficult for Moses sometimes. Like he's like,
Now you eat way more beef than me. She's
yeah,
a red meat king.
but
don't eat that much red meat.
I don't eat, but other stuff. So he's like, no, I don't want that. I don't want baked chicken. I'm sick of baked
Hey,
chicken.
boy, her go-to meal, I'm ratting her out. She like this little rice bowl,
Yeah.
cilantro lime rice bowl. She cut tomatoes up in it and put that in. That's her meal.
Oh yeah.
And I see her
That's
put
it.
pesto in it.
Yeah, that's it. Sometimes I might not even have meat. Sometimes I might have meat. Sometimes I'm like bad. Sometimes.
I'm good. Yeah.
Yeah.
Sometimes I'm bad. Sometimes I'm good.
But the thing is, like initially, for years, I would always eat a salad with my hamburger, even Chick-fil-A.
That kale salad is.
Recently, I had just started getting French fries. I would never eat French fries. Never eat French fries. So it's funny because when I would go to the doctor, and I'll tell Moses my blood pressure was such and such. He's like, no, it's not. I'm like, so I literally had to start recording and taking pictures of what my blood pressure
Yeah, it'd
looked
be
like.
117 over 70.
And
That's
he's
hers.
like, what you mean? Or I'll say one, it might be lower than that. He's like, you shouldn't be living. I'm like, that is my blood pressure.
You have a normal blood
Yes,
pressure.
that is correct.
That he's like, that's not.
That's not.
Yeah,
And then when he started eating right and watching when he eat, his blood pressure started being like that. And he would come and say,
I'll be,
look what,
I'll
look
be
what.
120 over 72, 78.
Yeah, he's like, look what my, I was like, yeah.
But I had high blood pressure one time and did not know it. Remember, before 07, 08, y'all, everything I did, sweat just be rolling off of me. I do not sweat like that no more. You never realized that?
Yeah.
Because they say that's a normal mechanism for high blood pressure is them dry sweats.
Yeah, the thing is people they get accustomed to it, and this is a problem that I see pre-hospital. They just get accustomed to it, and then your body compensates, but in a bad way. It's compensating to keep you alive, but your pressure's still going up through the roof, and your body's only going to take it for so long, and then all of a sudden you have an event, you know, and it could be a life-ending event, or it could just be one where you survive it, and now you have this whole family member now having to take care of this person who has no control and no ability to take care of themselves, you know, and all of that could have been prevented by regular visits or by just coming to a realization that you need to be aware of your health.
Yeah.
And take care of
Education, and a
yourself.
lot of it is education because we
Education.
do not know. We don't. A lot of us don't. Yeah,
Yeah.
we don't.
And
know.
people don't like it. Antiperspirants ruined the African American community. We used to work without having them on. Sweat takes natural toxins out of your body. You work around the house, don't wear it.
I don't know.
I
about
did research on that.
Yeah,
Y'all
we
do know.
wanna do that.
I'm talking about when you home. I ain't saying
Yeah.
you go out.
Say that, but yeah.
Your nose is
Don't say
saying
it.
No,
something
but
different.
your nose saying something different, but y'all
Yeah.
do know sweat takes something out of your body.
I won't.
Some
I
people
won't.
don't sweat no more because they always win.
Yeah, I won't. I will have to look more into. You know, you've and I'm not denying it, but I'll say I don't know the research on that.
Yeah.
But I will say that I love the fact that in this time frame we've talked about regular yearly visits with your doctor. We've talked about diet and exercise. We've talked about prevention screenings, and we've talked about the financial implications that with you not making sure you eat right, go to your doctor, get your preventative screenings, can have on you and your family. You two are blessed because you all have preparation, and that's why I would love to have you all come back. Because there are a lot of families who are not financially prepared. There are a lot of families, single or married, who are young, who could put aside that small amount of money to be prepared. But I don't want you just to be prepared for death. I want you to be prepared to live. You know, and again, like I say, you know, when we talked about the survival rate, that why are black women surviving less than white women, and it's not a race. It's there has to be, you know, even with men, but there's a slight
It's not that
because the
different,
fact, because I think for me, in my opinion, because I think overall, regardless of color, with men, they are less inclined to go to the doctor. So they have less preventative screening. So they're going to be basically treated the same as you would say. Whereas we are more inclined to go to the doctor. However, yet we still have a lower survival rate.
Do you think it might have the picture of a healthy African American woman might be different? Because a lot of us, we like the way y'all look and the way y'all carry yourself, and that might not be healthy for y'all.
Listen,
I'm just telling.
listen.
That is something to
And
think
that's
about.
a little bit different from the other community because what they like is what they like,
their
and what we like.
characteristic
Now,
maybe
Brian, come on, we like.
Oh, sure.
You like
A-
a little
A-man,
thicker.
and that might
So-
not be that healthy.
Yeah.
Yeah.
You're
That's
but then also maybe genetically we can't
there's probably factors that
Yeah.
It's a
there's
probably
a
definitely
few.
factors
It's a
that we can
few.
change.
Yes.
Yeah.
There's
Yes.
some that
Something
cannot
cannot
change.
Yeah.
change.
You know, but it's also, which is a big part of what we're doing is education.
Mm-hmm.
You know, if you don't know, you don't know.
No.
You know, and you have to be educated as to these possibilities, to these, you know, things that you really have to consider. There's a financial aspect of it. You may not just be financially able to do the things
You'll go to the doctor as
to
often as
allow
they.
you to go to the doctor
And
to get
then
these screenings.
we don't
you know?
discuss in our community as well. We don't discuss family history too.
Right.
And that's why I
And
brought
that
that
is the
up.
biggest
You
thing.
can't shake genetics.
Yeah.
The doctor told that to me,
Yeah.
and it
Yeah.
changed my life.
Yeah, because with regardless of what you do, eventually, if that's your family history, that tape is gonna stop, and it's gonna be like it's your turn.
It should absolutely.
So
Diabetes
it
is
is. Yeah,
a perfect example.
exactly. Yeah, it is. It is for
the
most
doctor
of
been
us.
telling me
if
you're
your
gonna
brother's
be
got it, your mother's got it,
pre-diabetic.
your father's got it, but
Exactly.
you're 35 years old, you fine, and all of a sudden one day
Here it
you
goes.
can't stop
Yeah.
drinking, you can't stop going to the bathroom, you feel terrible.
Yeah.
All of a sudden you're in the hospital. Now your blood sugar is 600,
Yeah,
but you don't know why.
but you don't know
Know
why.
why.
Exactly. You know, and I don't mean me from taking patient histories in the hospital and me taking patient histories
Mm-hmm.
in the pre-hospital. Many times I've been to a house. Do you have any medical problems?
No.
No.
But I got AIDS, and I'm not just saying that.
Yeah,
but,
no,
you know,
yeah.
I got pressure.
Yeah.
But they don't know that that's high blood pressure,
Yeah.
what it's doing to them.
Oh, yeah, you know.
if it's a family member, what kind of medical history does your mother have? They don't know.
They
I don't
don't
know.
They got
I
a
don't
box
know.
full of medicines. They
Yeah,
have no
but you
idea
don't
what they
know
are,
because
why they're taking them.
we don't read the information. And when Mama get her diagnosis,
Yeah.
she don't want to tell anybody because she don't want to scare the
Exactly.
family.
She don't want to be a burden.
But you
know,
got to
you
help
got
the
that right
family.
there.
You got to help the family
Here's
because if
another
you don't
thing.
tell them,
Here's another thing. I've been the patient.
Oh, listen, I just have to sit back and because I have to give that generation grace. But a lot of that
yeah,
just
that I don't want
won't
to
say nothing. I don't.
Yeah.
And then it's like they come with their family to the hospital and they have all of these pills.
Have no idea what
They
they're
have
for.
no idea, and it
Nobody
can be
understands.
yes, and it can be very confusing. And you know, the daughter, the son, or whomever, even the spouse, like I don't know what she, you know.
Sometimes the patient don't know why they're taking
They
it.
don't
Yes.
know.
My doctor told me to take it. They have no idea.
And that
They
is
have
the
no
and that,
idea.
and that is a big conversation we always had. Read and ask. That's why they give you.
I have to help my dad. My mom is deceased now,
Yeah.
but you have to help them because they'll go to 2 or 3 different doctors and they don't never take all the medicine
Right.
with them when they go to the doctor. and
Or
say
they
why
don't
I'm
even
taking it.
understand what they're taking, and that is the doctor's job or the nurse. Hey, if you didn't understand, it's okay to say, "Hey, repeat that again."
So I'm not. Yes, yeah, it's okay for the patient.
The
to say that.
patient, yeah.
However,
but they don't. They don't.
I will say, and that is another reason why we've created this podcast. I will say, in today's climate, they got to get you in and get you out. You and then you have to realize that the average literacy level for, regardless of color, is about 6th grade. You know, and so you're trying to explain this high blood pressure medication. And, you know, for me, especially once I became in the provider role, to see someone walk in, and you'll understand these numbers, with a hemoglobin A1C of like 15, and you're not on any medicine.
I didn't even know it go that high.
Listen, when I was like, oh my God, you know, like what, you know, so within that short time frame, I have to educate this person on at least 3 to 5 medications. I have to take into consideration, but I can't take into consideration because guidelines won't let me take into consideration because it's you need this, whether or not they can financially afford it. You know, then in that short time frame, discuss. And even though you can bring them back to have those discussions, I still have to think about when I bring them back. Do they have the time off from work to come back? You know, do they have a resource to get there to come back and discuss that? You know, can they financially, like, insulin is not cheap.
It's not.
It's not cheap. So now I need to tell you about blood pressure, diet and exercise, and taking it. And you know, even though you may see, you know, you've given your mom, or seen your mom giving her shot as a child, I gave my grandmother her insulin, and we were a nurse, and my husband worked in the hospital field. But Kim, you like you said, you're squeamish.
Oh yeah, I couldn't do it.
So just think of that patient that comes in that's squeamish, and now I'm telling you, you're gonna have to give yourself a shot every day, and you're like, you
Yeah.
know, and so those are some of the things that just I would want us in our community to feel comfortable to discuss with your like get your medications in order or know your family history. Have that
Yes.
talk. While y'all are
Yes.
sitting around and laughing and joking at holidays, have that conversation.
Gotta have it with the kids. 'Cause,
Yes, you
Yes.
have
you
to.
know, they
Because
need to know
they need to know.
if
Because that
something's
is the thing,
happening.
They
like
need to know
with
their
Taylor,
family. They need to know
like
their family
like
history.
some of your kids, they are genetically just like you. Like I could imagine Taylor probably having out of all our kids the thyroid problem, because certain things about her is a mimic of Moses.
Mm.
So like she's never like you. Oh, remember Moses didn't used to wear jackets. He would never be cold. There's certain little things like
Things.
characteristics. Like it's wintertime and you out here with just a sweater. I'm like, you're not cold. But though that is some of her behaviors, and it's certain like her skin is a little thick like his. Certain little
She swear we got thicker skin.
y'all do, y'all
But,
do.
but, look how in tuned you are.
yeah, but those are characteristics that, and then
You
even
don't
like
know how
right,
thick our skin.
yeah,
is.
y'all skin thick. Like and even like right now, like she does not eat. I wouldn't say she's a very unhealthy eater, but her cholesterol is always a little high every time we go. And so those are things like, and I'm looking at her like, well, you don't eat, and we going to,
Kimchi.
yes, and we going over this with the doctor while we're in there, and she's like, well, I don't know what it is, and then finally this last time she said, you probably need to check to see on her family history on dad's side is cholesterol, having high cholesterol issue. I said, you know what, I have to, because it's crazy, because what she eats and what her lab work is
Don't
showing,
correlate.
it
Don't
don't correlate at all. And I'm
Same
looking
thing
like,
for me.
So that's
yeah,
all-
Well, I
that's-
finally
that's
figured it
genetics.
out.
That's
Yeah.
something
Yes.
you just can't
Yeah.
get away from.
yeah, and I'm looking like,
But you still have to treat it, and you still have
and
to
you
do
still have to
something
do the
about it.
same
Yeah.
thing, because I'm looking at her like, you're not getting such as, and you, but it's not a lot of stuff that she eat like that. So
Yeah.
Now, again, that's all education. You know, that's what we're
Yeah.
here for.
yeah.
Just like with as Warren was going for, having consistency with your primary care. So like Brian has, and I'm thankful for it. I know it sounds crazy. Brian has taken Warren to literally every yearly doctor's
that's cool.
appointment. Um, he makes the appointment to where the point I just got used to it.
It's just like,
but
that's not my job. That's
but-
his.
those labs came back to me,
Oh.
and
She was
so
aware. She
I was
hadn't
aware.
been at the
Like
doctor's
I don't
office,
have to
but
be
she's
there because he's,
definitely
he's
aware
doing
of what's
yes.
going on with it.
And so I wanted to make sure at his 18th doctor's when he turned 18 at that doctor's appointment. Okay, Brian, go ahead, get a hemoglobin A1C.
Yeah.
Go ahead, get a total cholesterol. Get a lipid panel. Go ahead, so I know where his cholesterol is
Where is
seeing.
it?
And at those visits, his blood pressure was running a little high. So whenever he goes somewhere, and he just finished his Invisalign. Was it Invisalign? Yeah, and they take his pressure. Like, I want to monitor
You
his
wanna see
pressure.
it, yeah.
Because I want him
To be cognizant.
to be
himself.
cognizant. Yeah,
Yeah.
cognizant himself. I know that we have to get more active, and we both had like very sedentary jobs, and so now we're kind of.
It's hard to get back on the saddle. I understand, because ooh.
If I could pan that camera to that Peloton that has not been used.
Oh gosh.
But you know, I respect people in the medical field because you see the best and the worst in people, and I don't know how I could deal with that. Because you could see it. You could see those
It's
who
hard
trying to,
sometimes.
It
and you
is.
could see the ones who not gonna put the effort in.
Oh,
And
Yeah.
you just
yes.
Yeah.
But then I also, with me now, as my role has changed more from a nurse and bedside to more as a provider, I do now look a lot more at the mental aspect of it.
Yeah.
Those play. I do again give grace because life is hard out here for a lot of people. Um, and like for instance, especially if when I at my previous employer, when my black female patients would come in, it's almost as if, even with my males, for some reason I could feel like they were pent up, and I would tell them, please take off that cape, like, let's go, let it, and I do feel like representation matters.
Yes.
So I felt like they were comfortable with me. Um, I miss my patients
Because
dearly.
you gave them
I gave them a safe
space.
space.
That's what I was gonna say. They were safe to expel whatever it was, and then that helped them understand what they needed to do to go forward with their health.
Right. And I saw them more compliant. They seemed, I enjoyed
Yeah.
I did. Like,
Because you were giving them what they needed, and they probably
Right.
didn't get it before when they saw different providers.
yeah, I can't say that because, the provider who I replaced was great, and the
Yeah.
one who she replaced was great.
But she wasn't giving them. She could have been great, but she wasn't giving them what they needed. Like, it's a
No,
difference.
they did. I won't.
No, I'm not
Yeah,
saying
yeah,
no.
yeah.
It's a difference when it's coming from somebody who kind of look like you and feel like, okay,
When
you
they
feel
came
like
from,
family.
yes,
Yeah,
when
you
they
feel
came
like
from
family.
yes,
Yeah,
when they
you
came from
like
other
family.
places,
Yeah,
they did, and like,
yeah.
when I knew it was time, when I had to move on, and not because of them, but because I wanted to be on a broader, a larger platform. So I knew I had to adjust my work-life balance. They were sad. I was sad. I felt guilty, but I also knew how important health literacy was, because I'm not saying, like you say, there are some out there that, regardless of what you say, they're going to do like, oh, I could just do so and so and so. But I feel like if a person, and I said that the other night, if a person takes their time out to come, sit, wait, get the labs, there's some level of compliance there. Um, it's just, nobody wants to admit I can't afford it. Like, I had some patients say, "Hey, Miss Duncan, you got to stop calling me in here so often because this copay,
I
or
do
look,
my doctor
I went
like that.
I went to go pick up this medicine and it was this amount of money. Those are real life struggles
Yeah,
for
Some people with
individuals.
HSAs, and I'm talking about they 6-figure people, don't go to the doctor because
Yeah.
their goal is to invest the HSA money.
Yes,
Look, I
Y'all
do my
know
doctor like that though. I tell her all the time, listen, you got to send me where my insurance is going to pay the max. Don't just send me because you want me to go there. Now, Yolani, send me.
not the first name.
Yeah, look.
But I'm gonna give Mimi and Brian kudos on their podcast though. The more you talk about these things, it help people with mental health. Because people think mental health only when you're struggling with things. Sometimes stuff you just don't know about, you just don't know.
Yeah.
And you be stressing out it. I think about my mental health when I didn't care about going to the doctor and all like that. It's because it just went in. It didn't mean I didn't care. I just didn't mentally prepare myself that it was
Important.
something bigger.
Yeah.
So kudos, because the more you
Thank
talk
you.
about those things, it make it way people process it. Because some people think if you say you got mental health things going on that you're crazy, or you bipolar. I hate to hear people say everybody bipolar. You're not bipolar. It's just
So such a
working
negative
through it.
stigma
Stigma.
with mental health.
Health.
It's not all bad.
Mm-mm.
It is what it is.
It
you know,
is.
and you just you need to be educated
And get the help.
Because
and
you
get the
might
help.
have a mental health issue.
Issue.
You don't care about your health.
Yeah.
Thank
Yes.
you. Exactly.
No, seriously.
Thank
absolutely
exactly. I put the podcast off for a while because it was, I don't know. I let fear. I said it on that. I just interviewed a friend the other night. It was fear. I felt like it wasn't coming out perfect. And this last year, just working with my patients, I personally felt like God was telling me, you have a bigger platform, and and you need to use it. I'm not an expert. I tell anybody, you still need to follow. I'm not here to give you medical advice, but I am here to tell you, you need to seek medical advice. You need to feel comfortable seeking medical advice. You need to, if we can form groups to where we can discuss, I want to have a nutritionist. Like you said, you change your diet. A lot of people don't know how to do that. And especially with increased inflation, regardless on how you say inflation may go, a $4 carton of eggs it's not easy for a lot of
people.
families.
E-
You can
even
eat bad cheap.
and
Thank
not
you.
and not only that, I mean
Seriously.
just
Yeah.
all the way around. It's just how things are going up, but the packaging is smaller,
Yes.
so it's not the same.
And if you have a large household,
For
to take
household, yeah, it's not the money that you fed somebody 4 years ago is not gonna feed somebody today.
Not at all.
correct.
Yeah,
And so if I'm expecting you to eat healthy, like I I would tell my patients, with the limited resources that I had, hey, let's, because I remember learning, let's try to shop on the outside of the grocery aisles. Let's go for your fresh fruits and best vegetables, your lean
So you
meats.
start first.
Yes,
yeah.
let's lean away from your processed foods. But if that processed food is $1 and something, and you have children to take care of,
It's a choice you got to make.
then
It's a
I
tough
have
choice.
it's a tough choice.
Yeah.
So then I have to tell you, well, let's reduce your portions.
Exactly.
Let's get out there and exercise more. Let's, while your kids are at football practice or basketball practice, while you're still trying to provide that better lifestyle, they have a coach that's coaching them. You can take some laps. I'm not saying I always did it.
I know, right?
Listen, because that was my mental wind
That was
down.
a break. That was a break. Like me process, and then I'm processing what else I got to do when I get to the house. Okay.
So you never really get a break.
I know. Let me line this up.
Did I take something out to cook?
Yeah.
I got to do this.
I got to get the
gotta
clothes
do that.
together. I need to do a load of clothes.
Yeah.
Plus, she a mental health provider. She just don't realize.
No.
No, for real. Our son is autistic. She had a daycare. She stopped. She ran that, and she dedicated her time to doing that. Then she took on me. I know I'm stubborn. It helped my health care. All the kids, and she think I don't know her. All her friends call and talk to her.
I know.
And
I
she
be on the
work through
phone
it.
with her.
Look, we be working through our issues together.
Yeah.
But that is a form of health care.
It
And I
is.
tell people
It
that.
is.
And just God bless it where she could do that things for us. So, I get jealous sometimes sharing it with the world, but
But thank you for sharing.
yeah,
Oh,
We
You're
appreciate
so
you guys.
sweet.
Yes.
but I do realize it because
Yeah.
you can get caught up in things and you don't realize it. But I know she be helping everybody else out, and
And
hold
Mimi's
things
the same
down.
way. I mean, it's always everybody else she's looking out for, and always putting herself second. And she's just that's who she is. I think that's ingrained in her nature.
Just a nurse in her.
And, I mean, I think that's just what she's learned. And that's her essence. And always thinking about somebody else first.
Yeah, and we had to
Especially
share
since you
them.
say,
And,
see, you said I didn't know that portion that you took care of you helped with your grandmother. So,
Yeah.
so that's
But I was young,
But you was
so
young, but you don't even realize
I didn't,
that.
my mom's a nurse.
Yeah.
So it's just
It was in your soul.
so yes,
It was
it's in my
your
soul. So I think
Yeah.
in my soul, especially through our turbulent times, to go on certain websites that no longer exist,
It's a hindrance that we still
yes,
passionate about trying to overcome.
Yes, and so I can only start in this room, in this community,
And it is gonna get greater.
and then and go from there, But I do think that there are other platforms that do it, and a lot of other platforms bring on health professionals. I just wanted to get it from a perspective of the individuals who are living it, and I want to bring on individuals who have expert knowledge, but I want individuals to feel comfortable to say, oh, I feel the same. Like when you discussed your guilt and those feelings, those range of emotions you talked about the first time you got sick, but look how you conquered that and turned that around. And I talk with my hands a lot.
I know. And then the second time when you got sick, it wasn't as bad. You like,
She
okay, I gotta
not
do
related.
this.
She used her hands a lot
I gotta
too,
do
so,
this. I gotta do this. When you got sick the second time, it was like, okay, let me. Even though you was a little stubborn too.
But let me ask you this question. Do you think, and we'll tie it up, do you think that because you all are financially prepared for the worst, that it kind of lessened the anxiety?
No,
It didn't, okay.
no. financially prepared is just one thing off to the side. I tell this to anyone: if you think you got money, certain things money can't help you
You
through.
can't fix. Yeah.
You can't go buy your health.
That's true.
You can't go buy peace of mind. You can't go buy happiness. Now,
That's,
half the world think you can,
but
you
you
can't
can't.
do it. You could be miserable. And I tell this to everyone: no matter what, I could have had $100 million. When my butt was sick, laying in that bed, it did not matter.
Okay.
I tell that to anyone.
Okay.
I tell you, get to that point, and all your beliefs go out the window, and somebody else got to take care of you, and you can't be that cocky self you want to be, that one who pull their own self by the bootstraps. It's humbling, and everybody deal with it different. You just have to get to the point. I can't tell everybody how they gonna deal with it, but when you get to that point, you'll know. It's one of them things is you got to go through it to really know what it feel like. It's like losing a parent or something. I can try to explain it to somebody. I've been through it, but somebody who never been through it, they looking at you like. But till when they go through it, then it's kind of like this whole range of things.
Yeah.
You don't know how to deal with it. You don't know what's next. You don't want to be weak. You don't want to be vulnerable. And I'm just coming at it from a man perspective.
Is that how you felt, Twin?
I would say that I haven't given it as much thought as Moses had. I haven't had that life experience to force me to think about it that way. I don't want to leave my family in a predicament, and I certainly could be better prepared at this point than I am now. But with my wife's help, definitely going to hopefully get that way.
You better prepare than you think because you got awareness. Zero awareness
He
is
has
the
a-
issue.
yes.
Well, I will say that I have that advantage. A lot of people don't have that awareness. So I'm blessed in that respect. But I think there's a point where you could always be better.
But it ain't money. I tell that to
I
everybody.
realize
It's
I realize it
that
ain't money.
awareness
I
get
know
you
money
way
can't buy a
further
lot
than
of
money.
things, once you laid up
Absolutely.
in the bed somewhere,
Yeah.
all the money is not going to fix
No,
you.
it's not gonna fix.
But our goal here is to just at least try to bring some awareness to where that hopefully that eventuality doesn't have to be realized. And you can live your life happy and healthy, as best you can, as God will allow, and just do what you can to be the best you can be. I want to say that's one of our goals. That's important.
Well, our little health dog.
He fell asleep. Look, he fell
Oh,
asleep.
okay.
And he fell asleep.
Get a dog.
Like
a dog help.
Listen, like a child. He went to sleep. She went to
It's
sleep.
time for
She was
nap.
burning up a lot of energy, so she
I
ain't
know,
just-
right?
You got issues, get a dog. Trust
Yeah.
me.
So I want to take this opportunity to thank you all so much for taking the time out of your day. Like
quite
you're fitting
welcome.
it in between,
Yeah, well,
and it means a lot. It does. It means a lot. I want individuals to understand that health awareness starts with knowing your medical history, feeling okay with knowing with asking your family about your family history. We will discuss different health screenings that you need at certain age, at certain points in your life. Understand that it starts with you, diet, exercise, and it is okay to change from your norm. If your norm is not healthy, it's okay. It's little steps like
Make a new norm.
yes, make a new norm.
It really
It's
It
okay to
does-
discover new stuff.
absolutely. It doesn't. It's not always financial. You can make changes to your lifestyle that don't cost you a thing.
Exactly.
Getting up instead of watching TV for an hour, get up and go walk for an hour. Everybody knows that has tremendous health benefits, and that may be one thing that keeps you alive one more day.
Don't use the elevator. I use steps
Steps.
at work
Yeah.
every day. I park so far away from the door, the furthest point. It's the little
Things,
things.
it's the little things. Yeah.
But you have to be willing to
To-
be open to suggestion, to be open to receiving the information, and then actively making a change.
Yeah.
With you guys' help, hopefully a lot of people heard that, and we, like I said, we appreciate you coming on.
We
and
appreciate
sharing.
you.
No, we appreciate y'all.
Keep going. Keep
Keep
going.
Thank you.
Keep going.
You know,
Thank
carrying
you.
the news is it's a blessing and it's a burden.
Yeah.
Yes.
So keep going.
So
Keep
you know,
going.
every blessing got a burden. So
Yes.
With
you
advice
blessing
like that,
everybody else. So
with advice like that
understand.
coming from you guys, that's
Let's
motivation.
thank you.
to keep
That
it
is
going. So we
motivation.
appreciate that.
I appreciate it. Because many people don't know I've been dealing with this podcast on and off since 2020. You know, because it all started as I was going to finish nurse practitioner school. I was going to join the health ministry at my mom's church and do the blood pressure. And then I was like, oh, I want to go to the different churches and do little segments. Like I had all these little, and then COVID hit. And then I was like, oh, well, I guess I got to, you know. And somebody said, well, why don't you do a podcast? And I was like, I don't, you know, I guess I'm sure a podcast had been out there, but you know, they weren't
As popular
as
or
popular as they are.
and it's formative too. The ones
Right.
that were out, they wasn't giving a lot of good information. It was just yeah.
Kind of
Right.
a novelty.
Yes.
Right.
And I don't think
Yes.
people realize that it really had a purpose. Or it could
Exactly.
be used purposefully.
Because I learned a lot of things through podcasts
Exactly.
during the
In this day
pandemic.
and age, a lot of information you're getting.
podcasts and
YouTube.
YouTube.
That's right.
Yes.
Yes.
Yes,
You can
and
build a house with YouTube.
Exactly.
Yes.
Fix a car.
Almost do surgery, you know?
and
Hey,
then
you can diagnose your health issues.
listen, okay, listen, and then I would, you know, then my son got interested, and I don't know what I would do if he did not take the deep dive into the technology that was needed. And then I began the first time, and I really allowed fear. So I will tell anybody, do not allow fear to dictate your movements. It will kill your joy. And so when I took a step back, and then that step back just extended longer than I anticipated. But during that time frame, I did the work. I got the name trademarked.
So you was just doing it. It wasn't a
Yes.
step back.
It was a step. Like I took a step back. I took a step back because I was scared. I got it trademarked. We did go take. I wanted it to look more professional because for me, it's about. I want as many people to say, "Oh, that's interesting," and
interesting.
willing
And
to
listen.
listen.
Yeah.
It's not about.
The numbers. It's
It's not about the show.
yeah.
It's about intriguing you enough to listen and be engaged. And then just recently, you know, I put a post on what made me just like, because listen, we've been ready to go since when, Warren? I'll
Ready to
even
go for a minute.
For a
well,
minute.
I wouldn't even deny and say almost a year.
Oh, good.
And I mean, we went and took professional pictures. My trademark had came back. But I was making the changes with reducing my workload so that I could focus more on it. And then recently, with the whole everything that's going on, I felt like everyone was expressing a lot of anxiety online, and I was like, "Hey, everybody, let's just take a step back. We anxious. It's organized chaos. Just take a deep breath." And I'm gonna say his name, Kevin Germain, the individual who helped me in the very beginning, who he designed my logo. He sent me a text. He just said, "I would you are calm that you don't understand, and I would implore you to please continue." And that made me say, let me put the car in drive and say, let's go.
Keep going.
So I thank you all.
Thank you.
There will
for
be there.
having us.
Thank you. Thank you.
So
There will
you're
be
a registered nonprofit?
no, not yet. But I did take the class. Because my goal would be to start a non. I mean, I don't mind putting my dreams out there. I would like to start a nonprofit. I do. Kim already knows. I already have a name. I already have a logo design. Because what I want I don't want to provide healthcare services, but I do, and I'm sure there are other nonprofits who may do it, but I want individual healthcare providers to link together to provide information sessions so that when individuals come and say, "Hey, I need a doctor. This is who a vet. This is who is available. Places where you can go at to get information for, where you can get free screening." Because a lot of the burden that a lot of individuals have is no access to care, and I don't think even people realize just how few specialties we
Here,
have
oh my gosh.
in like Savannah is growing,
But
but
not in the medical side.
yes, not we don't have an abundance of specialty providers, and we don't eat right, so we have increased risk of stroke, heart attack. There's not a whole bunch of cardiologists here. There's
And
not a whole bunch of
even a lot of
neurologists.
doctors, they're retiring. Some of them
Yes.
retiring and they're not
GYN.
coming here. Yeah,
Yes,
especially GYN. Oh my
GYN.
gosh. Yeah.
They're retiring, and so people are like, "Oh, I need a referral." Okay, I can give it to you, but
Yeah.
it may be
They may be a wait
maybe a
list.
couple of
Yeah.
months. And I think if and I may
Even
be
like neurologists, like the neurologist. I went to a neurologist and it took every bit of because that wasn't a major
urgent
issue.
issue.
It took 6 months for my appointment
Correct. So
because it
just
wasn't urgent.
so just think of that person who has that major life event of a stroke or a heart attack, and you need that follow up care. Them appointments are not just
Yeah,
laying
they
out there
not.
for you, you know. So I think the one way to combat that is through preventative care, is knowing what your numbers are ahead of time. Yeah.
Absolutely. That's the biggest thing.
Yes.
Biggest thing. You got to be aware of what's going on in your own space,
Yep.
so you can be prepared and try to mitigate anything that can happen to you. You're not always going to be able to do that, but at least be having awareness
Correct.
of your own health history, so you can be prepared
Yeah.
to any degree better than you are today.
Correct.
Yeah, I'm proud of y'all. If
Thank
nobody else
you.
tell you, amen. Anytime I
you.
see somebody with purpose, good things always come when you
Yeah.
put some stuff in purpose.
That's right.
And all you got to do is have that mustard seed of faith and
Yes.
keep doing that work, and always good things come out of it.
And look, you was doing the behind the scene work, so
I
you was
was.
just doing.
I was-
It's just little baby steps.
It was
just
ba- I was taking some-
you was taking little baby steps.
I was taking
It's
little
okay.
baby
It's
steps.
okay.
Yes.
It's okay. As long as you get to the
I
goal.
think we're off
Yes.
and rolling now.
Yes.
So
Yeah.
So-
Keep going.
So with that, I want to thank y'all again. Kim, like I said, we would love to have you back because there is Autism Month coming up, so I want to talk about that to make individuals feel comfortable.
Yes.
And I think it's something that's needed.
See,
But-
y'all can use her as the case study. She got about 4 businesses I'm trying to make her open. So y'all can hold her accountable for me. I'm tired of working. I want to work for her. So,
Okay.
let's get
So
to it.
yes.
she got to get to it.
Yes. So, well, thank you all again. And once again, we always tell you to like, follow, subscribe. Did I say all of them, Warren? Okay. We will have the website. Hopefully, by the time this comes out, we'll have the website up and running. But yes, like, follow, and subscribe to us. We'll be on YouTube, Instagram. I will get the Facebook. I'm learning as I
Yeah.
go. I'll get the Facebook,
Spotify.
Spotify.
Oh,
Yes.
okay.
yes.
Okay.
Spotify for the podcast. And once again, as always, thank you for listening to
The Black Health Perspective.
the Black Health Perspective.
All right.
Y'all have a
Hey,
good night.
cool.
Okay.
Thank you.
Hey.